Hey everybody, welcome to our first live virtual surgical event here at Weiler Plastic Surgery with board certified plastic surgeon Dr. Melissa Hogan. We're so glad you joined us. Today we are talking all things breast, and we want you to stick around because there are specials and giveaways at the end, as well as a live Q&A with Dr. Hogan. Here we go. Welcome, Dr. Hogan. It's so great to see you.
It's great to see you too.
All right, so we have a lot to cover today, so shall we jump right in?
Absolutely.
Okay. Today we are covering the many surgical options for breasts, what those surgeries entail, and for all the patients watching, should they choose your practice, what they can expect. Okay, so start us off, Dr. Hogan, by really just breaking down the surgical options that are available for breasts.
The first question I always ask patients, or do you want to be bigger or smaller? So
Okay.
That's the number one question. And then we go from there and we tailor that consultation to the patient and get her to the goals that she's trying to achieve.
All right, so let's break it down. She says she wants to be bigger. What are those surgeries?
So breast augmentation, love a breast augmentation. Patients that come in that don't have any breast droop, anything like that, those are patients that are great candidates for breast augmentation. We always talk about multiple options, silicone versus saline. That's always the number one question.
Yeah.
The majority of our patients do silicone implants these days, and we basically take them step by step through the whole process and get them to where they're comfortable.
And then the flip side of that, she wants to go smaller.
Smaller, that comes into breast reduction or breast lift. They're very, very similar procedures. The difference between a breast reduction and a breast lift are really going to be the amount of tissue you're removing. What we're doing in either one of those procedures is really bringing the nipples up, making a perkier, more youthful breast, really. And it just depends on how much tissue you're removing, and that's going to determine whether you're having a lift or a reduction.
And then finally, for those patients who maybe have had, let's say they had saline implants, they want to switch them out, what are the options there?
Multiple options. So my ladies that had breast augmentation around 89 to 2001, that was when the only thing that was on the market was saline. Those are my women that are coming back in. Their implants are over 20 years old and they're looking for a change. Sometimes they want to change implants and they go into silicone. Some actually are comfortable with saline and that's where they stay. And then there's also other procedures that they sometimes need. Sometimes they do need a lift. Sometimes they want to go larger or smaller. It really just depends on the patient. Their priorities have changed through the years and I really kind of take them through that and get them to where they want to be.
So it boils down, really come in, let's talk through what your goals are and you'll structure the surgery around that.
Absolutely.
Start us off, Dr. Hogan, with really just breaking down breast augmentation. We know it's been around for a long time. Talk us through it.
Breast augmentation, again, it's one of our most common procedures that we perform in our practice. It's a great thing to kind of just add volume. There's a lot. It really is a personal preference as far as sizes, things like that. We take the patient step by step through that process. I'm a proponent of placing the implant under the muscle. I make an incision in the fold of the breast. And really, as far as size, we really want to find something that fits the patient's body and their frame. So we're really, really cognizant of that. We're making sure that we are fitting the implant to the patient.
And then talk a little bit about surgery and recovery. I know that's important when someone's considering.
Surgery lasts usually an hour to an hour and a half. And then really the recovery for the patient it's maybe a couple of days, truly.
Yeah.
Really what patients feel is a little bit of a muscle stretch because we've gone under the muscle. It is not necessarily excruciatingly painful. It's really just that muscle spasm and the muscle stretch. Once you get through the first 2 days, patients do well. Usually at the 1 week mark, we remove sutures and we get into massage and things like that. So patients are really kind of getting back to their regular activities by about the 1 week mark.
And then, after that 1 week mark, in terms of, how long your implants last, what can a patient expect?
I always tell patients implants are not meant to be lifetime devices. If you're young, if you're in your 20s, there's a good chance in your 40s you're going to need another set of implants. I tell patients average of 12 to 15 years. But what that looks like is really patients are coming in. They've had children, their bodies have aged,
Yeah.
Gravity has taken hold. So usually they're coming in for other procedures. I need a lift, I want to go bigger, I want to go smaller. And at the same time, hey, let's change out the implants at that time. So it's not that you're coming back at 12 years saying, hey, we have to take your implants out. If you're not having a problem with them, we absolutely leave them alone.
You mentioned in there breast lift, which is a great transition. Let's go there next. Break down that for us. Why? Who's the patient? What happens?
So breast lifts these are my patients. Usually they're patients that have weight loss, or just patients that have breastfed and their breasts feel deflated. They come in saying that they have saggy boobs. So we call that breastosis. So what we're doing in that procedure is we're actually bringing that nipple back up and really kind of reshaping and remolding the breast to give them a better look, a perkier look, or a more youthful appearing breast.
Are you necessarily putting an implant in as well, or sometimes is it just bringing the breast up and an implant's not necessary?
It absolutely depends on the patient's goals.
Okay.
So if the patient really wants that upper pole fullness and really wants a larger breast, then that's where we would introduce an implant. We could do multiple sizes there. We could go with a small implant if you just want a little moderate look. If you want a larger implant, we can do that as well. So really what we're doing, again, tailoring it to the patient. What are their goals? If you really want a very impactful look, you can go with a bigger implant and a lift. If you want a more subtle look, we can also do that with a moderate size implant.
And then finally, in terms of recovery, what's the difference between having a traditional breast aug and a breast lift? Same recovery, different?
An aug with a lift, very similar to breast augmentation, a week or two. We do a lot more with scar therapy, things like that after a lift because we want to make sure that those scars end up beautiful. So over time, we'll see you throughout that process, make sure scar therapy is going well, and we see you throughout that process to make sure everything's healing properly.
You talked a little bit about scar therapy. Give me more about that. What is the scar? What kind of therapy so patients out there understand?
So for a breast lift, it's usually either a lollipop, which is it's around the areola and downward, a little vertical scar.
So just one vertical bar there?
Yes.
Okay.
Or it can be actually an anchor scar where it kind of goes into the fold, so it creates an anchor shape. At about the 2-week mark for any of our procedures, we're going to start scar therapy. That's a silicone-based gel, and we also do some taping. And we, like I said, we will see you at the 2-week, 4-week, 6-week mark, 3-month mark to make sure scarring is progressing normally. I always tell my patients, you're going to look good for the first 2 to 3 weeks. 6 weeks to 3 months, the scars are going to get red and angry, which is completely normal, and that's why I see you back to make sure you're comfortable. And then 6 months to a year, those scars are going to fade. And it's, again, like I said, it's working with the patient to make sure that they're going in the right direction.
Lots of one-on-one with your staff throughout the process. That's
Absolutely.
great to hear. Okay, Dr. Hogan, take us through explant capsulectomy, if I said that correct. Who's coming in doing that? What does it entail? Give us the details.
Absolutely. So patients that have had their implants for a long period of time can sometimes form what's called a capsular contracture. That is basically a scar that forms around the implants. Everybody that has an implant is going to create a scar. In my world, we grade those scars, grade 1 through grade 4. Grade 1 and 2, you don't know that implant's there, that scar capsule is there. The breast is nice and soft. It's not there unless I'm looking at it in the operating room. Grade 3 and 4 is a patient that develops a firm, hard, uncomfortable breast. It can be a sign of an aging breast implant. It could be sometimes a sign of rupture. So what we're doing in those cases, patients are usually coming in, they've got a firm, hard breast, and really we evaluate that. A lot of times we kind of evaluate the patient's goals at that time. Do they want to continue on with implants? Do they want to take the implants out completely? And we really tailor it to that. When we go into that for that procedure, we go in, we make that incision, we remove that capsule, remove that implant, and then if we're replacing the implant or we're leaving the breast alone, we kind of go from there.
And in terms of recovery for that, is that more invasive than just a traditional aug or a lift? Talk to us about that.
It can be, it just depends on where that implant is placed. If the implant's above the muscle, patients really don't feel that much pain with it. If it's below the muscle and we're doing a lot of pocket work, then some patients can feel a little bit more tenderness longer than a regular traditional breast augmentation. But overall, it's not a horribly painful operation.
And that timetable, does that start again? So if you're swapping out the implants for an additional pair, does that timetable start over in terms of another 12 to 15 years?
Absolutely. So that, like I said, the newer gels that are on the market average 12 to 15 years. And again, the timetable starts over again and you go from there. And basically, your breasts are going to continue to age. Gravity is still going to be at play at all times. So I tell patients, we'll see you back in 12 to 15 years.
Dr. Hogan, I call it, bonus procedures. So if someone has made a choice to have a breast aug or a breast lift, breast reconstruction, and maybe, they're a little bit self-conscious about, that bra fat or something under their arms, is there anything you can help with while you're there?
Absolutely. Patients, they always come to me and they don't even actually think about that. But sometimes when I'm examining a patient, I can notice like, oh, you've got this little extra tissue. Does it bother you? And if it does, there are procedures that we could do. A lot of times what we do with a lot of these procedures is add on a little bit of liposuction. Whether or not it's in that pre-axillary region, sometimes it's in that bra strap line, we can really help kind of contour the breast and really kind of accentuate the breast by liposuctioning those areas. And we do that very commonly with any of our breast procedures.
And does it add on to the recovery time?
Not usually. I do some patients that do have the liposuction in that area. Sometimes they feel like that is the more sore place as opposed to the
Really?
breast. But overall, patients, the recovery is maybe a couple of days, and after that, patients are doing well.
Dr. Hogan, there are a lot of surgeons out there, and when someone's considering a surgery, they want to connect with the surgeon. They want to know that they're going to be taken care of. Why choose you at Weiler Plastic Surgery?
I really love creating relationships with my patients. I really want them to feel comfortable with me. And really, I like to try to get those patients back to the confidence they had before babies, before weight loss, and I feel like I can actually understand where patients are coming from.
Well, thank you so much for the insightful information. We really appreciate it, and I know the patients watching out there, it's been helpful to them too.
Thank you.
So I'm a mom of two who breastfed both babies, one for 3 months, the other for 7 months. I had small breasts before, pretty deflated after I breastfed. Always self-conscious about my breasts in bathing suits and shirts while undressed. So having this breast dog has really boosted my confidence a lot. I chose Dr. Hogan because I saw that she's a mom of 3 as well, so I felt like it's really rare to find a surgeon that I connect with as a mom and just felt really comfortable with her. Everybody knows kids can do a little destruction to your body, so ever since I had this breast dog, my confidence has been great. So if you're on the fence about getting this procedure, I would say you will never look back and regret it. The staff at Weiler Plastic Surgery was nothing less than welcoming. My surgeon made me feel really comfortable with her, and the recovery process was super easy.
Thanks so much, everybody, for watching out there. We hope you've enjoyed everything so far. So a couple of surprises for you. Number one is anybody out there interested in breast surgery with Dr. Hogan, you can get $500 off that surgery if you book with Dr. Hogan before the end of May. Secondly, everybody out there watching can be entered to win 20 units of free Botox, a free dermaplane procedure, and a free diamond glow procedure. I've done both of those. They're fantastic. And then lastly, if you're ready, we're going to open up the floor for questions with Dr. Hogan. So make sure you enter those and she'll answer them all.